A very, very good evening, everyone. Very, very happy to be doing this first session of 2021. And I think there is some remnant of 2020 because we are beginning the new year on, with this session where we'll be in conversation with Dr. Aparna Jaswal, and we will be talking about sudden cardiac deaths and also a whole lot of issues related to heart, heart attacks and how to prevent them, what goes inside the heart. And we all know that we have Dr. Aparna Jaswal today, who is an expert, acknowledged expert cardiologist working in the Fortis Escorts Heart Institute, Okla at New Delhi. And she will be talking to us on this thing because we are also in the winter season. One season where I think this topic becomes very, very relevant and contemporary for all of us. So here's welcoming our guest speaker for the day today, Dr. Aparna Jaswal from the Fortis Escort Heart Hospital, Okla, New Delhi. And we also have our President Parul Trehan and all our EC members and all of you who have joined us, including Dr. Aparna's parents and very few male presence here. I think Ms. Nanil Trehan and all our ELSA members. A very, very warm welcome to all of you and a very happy new year 2021. And here's hoping that this will be a very good year for all of us, having had a not so good 2020. So before we begin, I think we will request Parul to also welcome our guests and all our audiences today on our virtual platform. And I'm also hoping that in times to come, we will be moving away from this virtual thing and actually doing more sessions in physical space. So for all of us who've joined, I'm handing this over to Parul to welcome us all, and then I will take our session with Aparna. Parul, you are muted. You have to unmute yourselves.
Thank you. So yes, thank you, Mugdha, and a very happy new year to each one of us here who's taken out time to be here. And I really actually wanted to take this opportunity to thank Fortis Healthcare, who have partnered with us as ELSAs, and they have offered discounts to all our members and to all our family members also. And on an all-India basis, this is on an all-India basis. So I wanted to thank Aparna, who really helped us initiate and get this partnership for us. And more than that, thank you, Aparna, for being here and hearing us, letting us hear you benefit all of us here. Thank you. So I think back to you, Mugdha. You can just take it from here, please.
So we had a little discussion with Dr. Jaswal before we started this session on how to format the session. And we both mutually agreed that we should begin by asking some very simple questions before we open our session to the audience. And as suggested by her, I think and also, I think it is relevant to figure out why we are doing this topic today. So we will begin, as I told you, by asking Dr. Aparna Jaswal, why are we today talking of sudden cardiac deaths? Because this is a term that we don't really use in common parlance. We talk of cardiac arrests, we talk of heart attacks, but we are not really talking of sudden cardiac deaths. So what is sudden cardiac deaths and why is it relevant to talk about sudden cardiac deaths in our session today?
Thank you so much, Mugdha and Parul. I mean, at the outset, I would like to thank her for giving me this opportunity to be here. And I think the seed was sown by her a couple of months back, and she was very keen that we do this, and I jumped onto it. So let me tell you why I jumped onto it. I think if I may say truthfully, as a girl, it's a dream to be a part of LSR. So I think this was one way I could connect with LSR. So thank you for taking me on and giving me this opportunity to be here with all of you. And you're the few fortunate ones who've like actually walked through the hallways of such a great institute. And also, I would like to let you know that I'm so glad because on this platform, I have some friends, I have my parents, I have my aunt, I can see Saroj Jaswal there, I can see my sister-in-law, Shabnam Akram, and some of my patients. I can see Mr. Arun Bajoria, who's very dear to me. He's also logged in here. So thank you so much. And I think without taking any time, I would like to move on to the subject, which actually is very integral to our daily living. And it is a very complex subject. Oh my, I can see another patient of mine, Deepika Mago's mother, if I'm right, from Molika Sharma. So hello, auntie. It's so nice to see all of you. So this is a very important subject that we need to discuss. The reason being, it's extremely complex. And the higher we climb the ladder of cardiology, further we deal with electrophysiology, further we go even ahead, it leaves us also thinking as to why is it that few of us die suddenly and we don't have the answers yet. So hence we chose this subject, and without taking much time, I want that if you can please give me the share screen rights. I would like to share my screen and take you along with that. Okay. So
I've just made you co-host right now.
Oh, can you see my screen?
Not yet.
Can you see my screen now?
No, no, not yet.
Hold on. Their screen. This. Yeah. You see my screen now?
Yes, we can see it now. Right.
Perfect. So I think I took this as an opportunity that we should discuss this for this simple reason and lay the foundation. If you see this, some of these videos which tell us as to why this is so important that we discuss this subject. So this boy, this young lad you see is a player, a football player called Miklos Feher. And this was actually captured on television. It was captured on television while he was playing football. So you can see him lying flat in the football field, and that was the end of him in the prime of his youth. I can see that frown on Parul's face. Exactly. It is so disheartening to see something like that happen. And something more recent, I think all of us are very well aware, is the death of Dean Jones. I think you must be aware, those of you who follow cricket, that he's a cricket legend. He was in Mumbai. He was actually a commentator, and suddenly in the hotel, he lost his life. So it's important we understand this component of it. And another thing which you need to understand, don't close it please, that 20 people die per minute due to sudden cardiac arrest in the world. So what does it imply? It implies that by the time we finish this presentation, if it is for 1 hour, about 1,300 people would have died during this session. Isn't it important that we all understood this and tried to prevent it? Because it is preventable if we actually wake up early in our lives and do the needful. So this is the reason that we are here talking about it. Before I move to this video, I think I just want to stop here, and you can see me, I'm sure. I have my video on if I'm right. I just want to share with you that this is the structure of the heart. This is how the heart looks. So if you understand and see the screen, you can see the heart sitting right there in the middle of the chest. And that's exactly the animation that I have brought in here. Is it visible to you?
Little higher.
Aparna, hold it
So
higher,
this
please.
is what the heart looks like. And if I may, this is what the inside of the heart lies. As I take you along, I will talk more. Before we move, I will just show you this little animation, and then we go ahead. Look at this. This is how the heart works. It is a pump. It is the strongest pump of human body. Look how it works. Pump the blood via this red blood vessel called the aorta. Everything in our heart is so intricately timed. The opening of the valves, the closing of the valves, nothing goes wrong. It truly is a scientific marvel made by God that it pumps the blood so effectively to the human body. So this was just to lay the foundation of it. And I'm happy, I'm happy to take questions from Mugdha as we go ahead now.
Will you, before we plunge into other questions that our audiences would have and also some that we would have, one has normally heard of the fact that, the sudden cardiac deaths or sudden cardiac arrest usually take place in the early morning hours. Is there some scientific, theory associated with people dying in the early morning? Also, because you showed a video, and closer home, we also have the, example of Dr. APJ Abdul Kalam, who, while giving a speech from the podium, collapsed and we lost him. So does in any way, we've also heard of cases where people, go for physical exercises, come back and they collapse. So does this, exertion in any way add to sudden cardiac arrests of people suffering from heart diseases? And if that is the case, the early morning and the physical exertion, because people with heart issues are asked to walk, and when they return from walk, they collapse. So is there any link between the two, the morning thing and the exertion that happens with heart patients?
Yeah, so I think that's a fantastic question that you bring up. And it is very scientific, the basis to have heart attacks in the early morning. The reason being, we have certain hormonal surges. If you're aware, we have things like epinephrine, norepinephrine. These hormonal surges increase our heart rate. So as we go along the session, I will have certain animations where I will share with you, which will answer the question with more visuals as to why is it that these heart attacks take place in the early morning hours. But you're absolutely right. So we tell our patients who are known cardiac patients that they must not go out for very early morning hour walks for this very reason. Because of the cold, there is constriction of the blood vessels. Further on, there is a hormonal surge. We often tell them that go out for a walk when there is sunlight during the day. So that's a standard instruction that we offer to our patients.
Okay, because you already have a screen share on the, on our screens. Will it be possible for you to elaborate a little bit of how the heart actually functions, giving us a few, in very general layman terms, for all of us to understand? And also, while you are doing that, if you can tell us, how we should be careful while you are, delineating the structure of the heart and how the functioning of the heart. What is the difference between how the heart normally functions and how the heart of a person who has some kind of a cardiac issue would otherwise have functioned? If you could just point out while you are showing us this presentation, I think it would be useful for all of us.
Most certainly. For the next few slides, I'll take you along the presentation that you will be able to see. So this is the normal functioning of the heart, as you can see. And the heart contracts. Now, these are the blood vessels. I just showed you that this is the structure of the heart. You have to understand that although this is the structure of the heart you saw in the video before that the heart was full of blood, but the heart in itself does not get blood from the inside. Rather, the heart in itself gets blood from the surface of itself, as you can see in these red colored blood vessels. They are red in color because they are carrying oxygenated blood. They carry oxygenated blood through the heart surface. So you can see this. You would have heard some of your relative who would have undergone an angiography. They say there is one vessel blockade, there is 3 vessel blockade. So this is what happens. Our heart has blood supply to itself with blood vessels which run on its surface. You can see here, they're running on the surface of the heart. And there are 3 blood vessels. There is one on the right and 2 on the left. The one that is pointed out now, LAD, is the most vital to human heart because it is the largest one. So you can see here these drops of blood which are going. That's how a normal heart functions. And have to remember that the heart has a blood supply and the heart has an electrical supply. Just like in your homes, you have the water supply, you call the plumber for it, and you have the electrical supply in your house, for which you call the electrician. Just like that, in the heart, separately, yet are linked to each other. So the electrical system of the heart is like this. So this is the yellow is the wires, the electrical wires which convey the electrical current through the heart and are responsible for the formation of the pulse. We are all aware that our normal pulse as adults is between 60 to 100 times a minute. When we sleep, it is low. When we wake up, when we exercise, our pulse rate increases. So the normal pulse rate is between 60 to 100 times a minute. This is how the electrical system of the heart works. You just saw how the blood supply worked. It works on the outside of the heart. The electrical system is intricately placed within the heart muscle, and these are special nerves. I know there is somebody in the room who has a pacemaker. So for their interest, let me tell you that this is the natural pacemaker of the heart. And when we position the pacemaker leads, we try to capture these nerves and further bring about the electrical system which is broken. So those of your relatives who have a pacemaker, normally as we get old, it is this part which gets dysfunctional. Why does it get dysfunctional? In a very simple manner, I say, just as you get wrinkles on your skin, which you can see because it is on the outer surface. The heart also gets wrinkles, but you can't see them. So how does it express itself? The wrinkles of the heart are expressed by abnormalities on the ECG. And one of the wrinkles is this, that your electrical wiring breaks. The other wrinkle is what I just showed you, is the blood vessels. So as Mugdha asked me, what happens to the blood vessels? Why is it when we go for an early morning walk, or why is it that when we go for an exercise, we get a heart attack? So let me try and answer it from this simple animation. As you can see, this is the heart, and this heart supplies blood to the blood vessels of the body. Now, we have taken this cross section of this blood vessel just to give you an example. So this is the blood vessel, and we have gotten a section of this blood vessel, and see what happens inside this blood vessel. So what is happening here? The blood vessel is blocking. Why is it blocking? This is blocking because there can be several reasons which block. You are well aware that those of us who have high blood cholesterol, the high blood cholesterol, I know there will be several questions to this. The high blood cholesterol can be because we are genetically linked, or we don't eat healthy, or as we get older, and because we don't exercise. As the cholesterol increases, it clogs up the blood vessels. When it clogs up the blood vessels, I will show you what happened. High blood pressure. Now, this is exactly what happens when you go for an early morning walk, and if you have high blood pressure. Look at this lining of the blood vessel. It should be absolutely smooth. But can you see here? It is rugged. It is not smooth. So when you have high blood pressure, the rugged part of the blood vessel attracts the blockages to happen. Or if you are a smoker, if you smoke, it also has certain chemicals, the nicotine damages the smooth blood vessel wall. As a result, there is buildup of cholesterol plaques at these sites, which are responsible for a clot to form. As a result, this results in a heart attack. Now, that's what happens when you get a heart attack. So I think I would want to answer further questions from Mugdha, which will come as to what happens if we have heart attack. So I think I'll pass over to Mugdha for the next questions, please.
You have actually explained very nicely. It was pretty lucid and very live to see what happens. And I think from these issues only will emerge the solution to how we can prevent a heart attack. But because earlier you showed us another presentation in which you showed a young man of 45 years, prime of his youth, who plays football. So I would like to link your present presentation, where you have spoken about age factor, you have spoken about the high cholesterol factor as a genetic condition. You have also spoken about smoking, people who are chain smokers or who smoke. I would like to know from you, because you made that presentation earlier where you showed a young man passing out on the field. What are the reasons, apart from the ones that you have just shown, or what could have been the reasons for a athlete dying on the field in the prime of his youth? He looks pretty fit from the picture. He is an athlete. I do not understand. I do not see any cholesterol on his body. What leads to the death or through sudden cardiac arrest of young people, which we have seen many cases?
Yeah, so that's a wonderful question, Mugdha. And I don't know how many of you all actually read the sports page. I truly don't, but my husband's a ex-Ranji cricketer and he is an avid sports person. So every time something comes up, he makes sure I read that. And let me tell you, in the past decade or two, he would have shared at least a dozen sportsmen who've lost their lives while playing whatever they were playing. So that's a fantastic question you bring up. And if you remember at the very outset, I said that it is so heterogeneous, sudden cardiac death, that we don't have true answers. Yet, amongst footballers, amongst athletes, what is the cause most often seen is not because of what I am telling you, but because they have a specific disease called hypertrophic cardiomyopathy. What happens in that subset is that the heart muscle is very thick genetically. But the reason I had kept that for later is because over 90% of the people who die of sudden cardiac death, they die because of this, like Dean Jones in his mid-50s, APJ Abdul Kalam, and hordes of them. However, there are certain other diseases called channelopathies, wherein the young succumb and athletes die. So that particular athlete, and let me tell you, all athletes actually undergo an autopsy, and they are the tip of an iceberg because they are heroes. You happen to know about them. You read about them in the papers. They're captured on television. So they're investigated much better. So those people who die have disease processes much varied, but they're in a much smaller number. Most often, more than 90% of the people who have sudden cardiac death die because of disease in the blood vessels of the heart. In fact, there was a world skater. He had won the world skating championship, and he was in his late 30s, and he died while skating on the rink with his wife several decades ago. And he also underwent an autopsy. And in his case, they found that he had blockages of the blood vessels of the heart. So I want to come back as to why is it? And we can take on Mugdha's further on. I'll show you that animation also if you want. But further on, moving as to why is it that if the blood vessels clog, why should you have sudden cardiac death? Also, let me put the question a little differently. When somebody is having a heart attack, which I'll just show you, why is it there is a panic amongst the patient, the relatives, and the young doctors and the senior doctors alike? What is it that we worry about? And this is what we worry about. So when your blood vessel clots, the problem that we have is this. Whenever the blood vessel clots, what is going to happen? It will completely clog off this blood vessel. You will see it is becoming smaller. The clot is now piling up, and now the blood vessel has blocked. This is again, you imagine you have a plant in your gallery and you have a water hose pipe and the pipe blocks. What will happen to the plant? It will die. It will eventually die, but plants still can take some blood from the soil. That's exactly what happens to heart muscle. The heart muscle cannot survive for more than a few minutes. As soon as it clots, it dies. And this is the problem. When that heart muscle dies, it is this dead muscle. It is this dead muscle which lays the foundation for the problems to come next. They give rise to arrhythmias, abnormal heartbeat. Sudden cardiac death is because of this little heart attack which has happened, because it will give rise to abnormal breathing, abnormal beating. So when the heart blood vessel clogs, our patients quickly develop dying muscle. This dying muscle creates complete chaos in the heart at that point in time. During the chaos that it creates, what can it do? It makes the heart beat. I told you normally it should beat between 60 to 100. It can make it beat 200 times a minute, 300 times a minute, and there is no effectual contraction. The brain receives no blood. When the brain receives no blood, the heart receives no blood, we die. So that's what happens to our patients. Happens. But you must understand this one point, that this is the example of what is happening during a heart attack. It's very important that we understand this, because if each one of us understands this, we can save a life. When we have heart attack, it expresses itself in some way. How does this express itself? The individual, the patient experiences sudden gripping chest pain in the center of the chest. It is as if somebody has tied a knot on the chest or placed bricks on the center of the chest, and the pain can radiate to your shoulders and can come to the inner part of your arms. Remember, in women, it may not be so. Women can present much differently. When women have a heart attack, it can present itself in a very different manner, like simple nausea, vomiting, or pain coming to the jaw, pain radiating to the shoulders. Women may not present themselves with a central chest discomfort. Hence, in women, it may go unnoticed. This is a point that you must remember. And it is in men that it presents itself with this typical presentation. Coming back to the scar, I told you, dying muscle. Now, when this muscle has died, because this blood vessel clotted, because of the death of this muscle, it results in conduction, electrical conduction abnormalities. It's imperative we understand there is a distinction between a heart attack and a sudden cardiac arrest. When there is a heart attack, I showed you, there is a clot in the blood vessel. The blood vessel clogs and expresses itself with chest pain. But when there is a sudden cardiac arrest, there is conduction abnormality. So you must understand the distinction between the two before I go ahead. And I leave it here for Mugdha to take it forward from here and ask me questions.
No, that's a very valid point that you raised about, because you showed in the normal functioning of your heart that there are two systems which operate in the heart, the plumber and the electrician. In fact, I was going to ask you that. When we talk of heart attack, is the plumbing system that is responsible, or the electrical system of the heart which is responsible? And if both are in some way responsible, how, as normal people, as caregivers for people who might have heart problems, or for our own selves, as we all are, will be aging in some time, how do we figure out what is happening inside our heart, whether the plumbing system of a heart is working okay, and whether the electrical system of a heart is working okay? To figure out through various tests, is there an age at which we must undergo certain kind of tests? So I think all these battery of questions on the plumbing and the electrical system of the heart, and how the heart attack and the sudden cardiac death are different from each other.
Very nice. So let me answer them. So coming back to the heart. Now, this is how the heart sits in the center of the chest. If you can see, there are small blood vessels. Can you see them? There are small blood vessels on the surface of the heart. Now, imagine, this is a big heart, and there are very small blood vessels. Can you see them, Mugdha?
Yeah, the ones in blue and red, right?
Yes. Also, if you can see on my screen, can you see on my screen here?
Yes, yes.
The blue and the red. Now, the red ones are the important ones. Such a big heart gets blood supply from these blood vessels, which are barely 3 millimeters in width. Okay. Now, whenever anyone has a heart attack, it is because of blockage of these red colored teeny weeny blood vessels. Okay. So when the blood vessel blocks, that part of the muscle is not receiving blood. When that part of the muscle is not receiving blood, it cries for help. How does it cry for help? By letting us know with expression of pain that I need blood. It tells you by sudden constriction in the center of the chest, radiating to your shoulders. So it tells you I'm having a heart attack, save me. So that this expression of chest pain is a heart attack. But why you're having the heart attack? Because the electrical system does not receive the blood. It should receive the blood from here. Because that blood vessel is clogged, the electrical system also goes haywire. The electrical system needs its blood supply to sustain normal electrical current. Where is the powerhouse which electricity comes to your house? From the transformer at the end of the street. So that transformer here is the blood supply. The transformer has stopped. How can the electricity work? The electricity stops or goes into crazy notes. It can beat 300 times a minute. So when our patients have a heart attack, there is a sense of urgency, both for the patient, the relatives, and doctor, because you want to save that muscle. If you don't save that muscle at that point in time, our patients can die during the heart attack. And supposing they don't die, thankfully, if they are able to survive the heart attack, but have not taken medical attention, and the heart muscle pumping has come down, has compromised what we call ejection fraction on the echo. And there is a scar. The scar means that muscle is dead. Now that scar makes a perfect milieu for abnormal arrhythmias later, which can also give rise to sudden cardiac death. So this is talking about the more grim part of it. But what Mugdha asked, that we're all getting older, how do we protect ourselves from what I said, especially because I said it is so heterogeneous? The most important thing that we need to do to protect ourselves is to take good care of our risk factor profile. And the risk factor profile is taking good care of our blood pressure, of our blood sugars, of our exercise regime, and our diet. So these are the 4 pillars to make sure that we do not develop disease in the blood vessels of the heart. We have to ensure that the disease does not happen, which we all attempt at. It can still happen. So we have to identify, am I at risk of heart disease? How do you do that? If you have these risk factors, if you are a diabetic, or you have a high blood pressure, or you are a smoker, or you have bad lipids, and you are post-menopausal, it's a good idea that how about going for a stress echocardiogram? Let me try and do an exercise test. Many people will come and tell me, doctor, I do treadmill at home. Why should I do a stress test? The answer to that is the treadmill at home has not been monitored. We must monitor, especially do these if you have risk factors. If you have no risk factors and you're following a healthy lifestyle, well, you have a choice. You have to then go back to your doctor and discuss it. But if you want to protect yourself, if you want to protect yourself and you don't want to have a heart disease, this is what you want to do. Because sudden cardiac arrest can be the first event within a heart attack. Hence, you have to ensure that you look after your risk factor profile very carefully and protect yourself from the progression of heart disease by preventing the clogging of the blood vessels, which I showed you in the initial stages. The second thing I just want to show you here is what happens when you have sudden cardiac arrest, which you want to protect yourself from. And this is what happens. Now, I told you the normal electrical system works like this. You have now seen this and you have now known this. But what happens when we have sudden cardiac arrest is complete, utter chaos And this is what happens inside the heart. Look at that. There is no contraction. The heart doesn't know what to do. It is called fibrillation because it just fibrillates. It cannot contract. Now, if it does not contract, it gives no blood. If it doesn't contract, it gives no blood. It has to contract to give blood to the body, means it has to give blood to itself via these small red blood vessels. It has to give blood to the brain. So when we have this ventricular fibrillation, it results in sudden cardiac arrest. We want to protect ourselves from it. It's very simple. If you don't have heart disease, protect yourself from it by looking after your risk factor profile. If you have heart disease, go back to your doctor, get your echocardiogram results. If your echocardiogram, a stress echo is normal, wonderful. If you have already had a heart disease and your echocardiogram reveals that you have a compromised heart function, that means the pumping of your heart is compromised. That means there is a scar tissue. You need to discuss with your cardiologist if you are at risk of sudden cardiac arrest. Because if your heart muscle is compromised, I told you that the compromised heart muscle can put you at risk of sudden cardiac arrest. I hope I have been able to answer Mugda's question.
No, yeah, absolutely. Thank you very much, doctor. In fact, a few more questions your way, and then we'll open up to the audience. And, you know, we often hear of, you know, the medical jargon which doctors use. And I think this will be a good idea to have you simplify those for us and tell us what they actually mean and when do we need those kind of things. Say, for example, when does a person need a stent and when does a person need a bypass? For example, when does a person need an angiography and what is the difference between an angiography and an angioplasty? So these are things that I think become very, very important for us to understand, since you've already told us how the heart functions, how the heart arteries get clogged, and how you know, the heart attack and the sudden cardiac arrest are two different things. So a little elaboration on these various terminologies which are used. And then we'll probably talk a little bit about how to read the heart, you know, the heart ECG, which is done, and whether ECG is a foolproof system to detect an early detection of the heart. I think these two questions, doctor.
So, Mugda, at the outset, you said the medical jargon. So with a little twist of sense of humor, do you know why we have it? Medicine is common sense. If we didn't have the jargon, all of you would understand what we speak. Mm-hmm. So we've made it very complicated. So the world doesn't know what we're talking about. So it's very simple actually. Mm-hmm. So that's why the medical jargon. So to answer your question, what is an angiography? Now, see these little teeny blood vessels you can see on the surface of the heart? Can you see them here? Mm-hmm. Now, these blood vessels have to be tested. How do we test whether there is a blockage or not? You can either do it in some test. Let me answer it the other way. If you do an ECG is a just 12-second tool. Unless you are having a problem right then, ECG barely can tell us anything. But if you've already had a heart attack, ECG will have a telltale sign. It has a memory of a heart attack, which it will display to us. But supposing you have a healthy heart, you want to find out, is there a problem? The best test, if you have no symptoms, you are in your mid-40s, you want to be tested, a good test is a stress echocardiogram. As doctors, we refer our patients for an angiography when they come with symptoms suggestive of blockages in the blood vessels. They complain of chest discomfort when they walk, especially. They complain of chest discomfort when they climb uphill or climb a flight of stairs. They go for a morning walk, they complain of chest pain, but when they stop, it eases. So that's called angina. That's when we want to do an angiography. That's angiography. Angioplasty means plasty. I told you, plumber, plastering, right? So angioplasty is opening up of the blood vessels. That can be either with a stent or with a balloon. Now we do with stents mostly. So angioplasty means putting in a stent. So you ask me, when should we put a stent and when should we go for bypass surgery? Now let this presentation not become like a WhatsApp university. You know, We as doctors fear the WhatsApp university students because they will say, I listened to Aparna Jaswal and she said 1 vessel blockage, I need a stent. It doesn't go that way. Whether a stent or a surgery should be left to the discretion of your treating doctor. But more often than not, if you have a single or 2 blockages, we try and tackle that with stents depending upon where the blockages are. If the blockages are multiple, more often than not, or you're a diabetic, it's important that we do a bypass surgery. As the name connotes, bypass, that means if the blockage is here, we put a vessel from here and bypass that blockage. So it's like a road bypass. You bypass the blockage and connect it here. So blood directly from here comes here and goes down. So that's how we do it. Bypass. So the simple tests are doing a stress echo or a TMT, or some people like fancy tests. They will say, let me do a CT angiography. The CT scan is reserved for high risk population. We must use all the diagnostics judiciously, seeing the economics of the country. A treadmill test is a very simple test, cheap test. We should opt for stress echo. CT coronary angiography is reserved for those patients who are elderly, frail, cannot take a regular angiography, or are in high risk profession like a pilot and you want to rule out disease. So that's when these modalities are used, but best left to the discretion of your treating cardiologist.
Yeah. Doctor, we have a few questions on our chat box, and I think I'd like to take them. So Mithali Chopra, in fact, if Mithali is here and around and she would like to ask a question, I'll invite her. If she'd like me to read it, I'll be happy to do it on her behalf. So Mithali Chopra, would you want to ask your question? If so, you can just
Yes.
unmute yourselves and ask the question, please. Mithali.
Yes. So hi, Mugga. Hello, doc. Good to hear you. In fact, this is kind of an eye opener. I just wanted to know when you talked about the pain in the arm. So are you talking about the pain in the left arm only or the right arm?
So the pain typically proceeds to the inner part of the left arm, but can also radiate from your shoulder to both the arms.
Okay. Okay. And any heaviness around the chest during the menopause time, as it is very common because when we are nearing our cycle, our chest tends to become a little heavy, and in between you do get that pressure and a little pain around the jaws. And also, do you think at our age, I'm 52, we need to show ourselves once, or it could
So
be
it's
just
not
because?
normal. It is certainly not normal at menopause to get heaviness in the chest. But if you are getting some kind of heaviness in the chest, which radiates to your shoulders, and you have a risk factor profile, it's worthy of a cardiology consult. And maybe a simple stress test can allay any anxiety that you may have, or may identify some disease which may be there.
Okay. Okay. Thank you, doc. Thank you.
Thank you, Mithali, and
Yeah,
thank
thank
you,
you,
Doctor.
Mugga.
We have another question from Snima, and I think Snima was also around. Snima, would you like to ask your question?
Sure. Thank you, Mugda. Doctor, my question was, you mentioned risk factors like hypertension, diabetes. Are there hereditary or genetic risk factors also?
Yes. So the risk factors, apart from lifestyle diseases, these are lifestyle diseases: hypertension, diabetes, dyslipidemia is genetic, smoking, lack of exercise. Genetics plays a big role, and we as Indians in itself are genetically inclined to develop heart disease. In fact, we, when compared to our Western counterpart, develop heart disease 10 years before the rest of the world does. I mean, if we compare with the Western counterpart. So genetics certainly have a link to play. So whenever we take the history of a patient, we ask them that do their parents have heart disease? And if yes, what was the age that they developed heart disease? Because that's how it goes. Having said that, there are several articles in medical journals that if we want, we can reverse our genes. Reversing genes is possible with intense work on yourself. If your parents are diabetic, it is not important that you will become so. You can reverse it by taking adequate care and instructions from your doctor so you don't become the diabetic.
Okay. Does that answer your questions, Nima?
Yes, thank you. I have another question, but I think there are others with questions, so I'll
come back to you, Snima. If you finish,
thank you.
And I'll come back to you. So we have another question from Neera Sood. May I invite Neera Sood to ask her question, please?
Thank you so much. I'm Neera. My question is that I want to know that, sometimes when I climb a flight of stairs in a hurry, it leads to a lot of panting. So is that a cause of concern? Because the panting continues for almost about 3 to 4 minutes after I have climbed. And it is kind of, it's heard by the people around me also. So I was just wondering if it's a cause of
If there's any kind of activity that you do which your system is not accustomed to, it can leave you panting. So it's more important that you build your exercise capacity. But if you see that on your routine activity, if you're getting breathless, it's a sign that you need to look in further. But if you're getting breathless only on doing activities which are not your routine, climbing 3 flights of stairs, 2 flights of stairs, that's normal because we don't do that in our routine. But it's a good idea to incorporate exercise, build your exercise capacity, and always when in doubt, seek medical attention.
Okay. And I have one more small query, because I had gone for certain tests and one of the doctors, did a C-reactive protein test or something like that. And he said, I mean, while we are on the subject of, whether we have this genetic risk factors. So he said that, my C-reactive protein was on the borderline and, so I was could be genetically prone. So I mean, this was sometime long back, about 8-9 months back. So I really don't recall maybe I'm not recalling it correctly. So I just want your comment on this.
No, you're absolutely right. So see, C-reactive protein does not tell genetics. Basically, C-reactive protein tells us that we have some kind of an inflammatory state in our body. So what is the meaning of inflammatory state? It means there are certain toxins which are troubling our body's blood vessel. I don't know if you were there at the very outset that when I showed you the animation that the blood vessel lining should be very smooth. Whenever the C-reactive protein is high in our body, it means the state of inflammation. We're going through COVID times. You're all aware. And I don't know if you're aware, when you get COVID, we have this certain set of tests which we do. C-reactive protein is one of them.
Okay.
C-reactive protein is high. And I don't know if you're aware, in COVID, people develop heart attacks. Because what the C-reactive protein does, it spoils the lining of the blood vessel. So you have to make sure that your C-reactive protein is very well controlled. How can you do that? By modifying your lifestyle. And there is anecdotal data that if you take something like folic acid, fall white, you may be able to counter the inflammation in your body. So yes, if your C-reactive protein is high, it's just an indirect marker of inflammation.
Okay. Thank you so much.
You're welcome.
Yeah, that was very interesting. Now, may I invite Sabina Pillai? She also has a question.
Hello, thanks for the chance to ask you a very simple question, Doc.
They will be the most difficult ones. Simple ones are most difficult.
This is basically to understand that, during winter months, I happen to come across a great deal of more mortality due to heart attacks. Is that a coincidence, a perception, or is there something that we need to be aware of?
Yeah, that's a very valid question. As I mentioned in the earlier slides, it's a known thing to happen. Early morning hours and very winter cold. Why? Because there is constriction of the blood vessels. I told you that these blood vessels, which you can see here, are barely 3 millimeters, 2 millimeters. And imagine 2 millimeter, 3 millimeter blood vessel. And then there is a cholesterol block on that. Now, if that has a vasoconstriction means it constricts. It will cause a heart attack. So cold in itself is a precursor. So we always tell our patients, especially who are prone to cardiac disease, to keep themselves warm, not to go out in the early morning hours for a walk for this very reason, that it's a known thing that you can have heart attacks in the cold.
Thank you.
Yeah, we have Vibha G. If she'd like to ask a question, Vibha. Vibha, are you around? Will you like to ask your question? Okay, I don't hear from her, so I'm going to read something that she has written on the chat box. So Vibha wants to know if the BP fluctuates by 20 or 30 points during the day sometimes, is it something to be worried about? TMT and echo have been normal. Also, sometimes the left arm and right arm BP readings are different by 10 points.
Yeah. So first thing is left arm and right arm readings will be different, because the blood emanates and the left is always more than the right. And second thing is that during the day, if your blood pressure fluctuates, well, it's a human body, things will fluctuate, our pulse fluctuates, our blood pressure will fluctuate. If it fluctuates by 10 to 20 millimeters of mercury, it's perfectly all right. But if you see that the fluctuations are beyond 30, 40 millimeters, it's important that you discuss with your treating doctor to get your blood pressure working better.
Okay, may I now invite Sarita Sarna if she'd like to ask her question? Sarita, are you around?
Yeah, could you ask the question?
Oh, okay. So ask two questions. One is by Neera. She already spoke, but I think I will just pick up her question as well. So Sarita's question is, does it help to do a lipid profile test to rule out heart disease? And Neera, I think both the questions can be answered together. Neera wants to know, how does one know about the genetic risk factors? So lipid profile test and genetic risk factors.
Yeah. So genetic risk factor is a simple family history. If you have a strong family history where your parents have heart disease and they developed it when they were younger than 50 years of age, that's a simple family history. Along with if one of your parents has succumbed to a cardiac illness before 50 years of age, a strong family history. And the second thing was lipid profile. Now, lipid profile is something which we need to understand. It is not just the lipid profile which predisposes us to developing a heart disease. It is always a multifactorial appearance. Having said that, what is it that you can see? Yes, lipid profile is something that you can see in black and white. You know that your bad cholesterol is LDL, your good cholesterol is HDL. So the guidelines, the world over, we follow certain guidelines, set of rules that we as doctors have to apply to our patients. All of us should strive to keep our bad cholesterol under check. Those who don't have any risk factors can keep their bad cholesterol LDL, say up to 140, 150. But those who have heart disease, who've undergone a stent, must strive to keep the bad cholesterol LDL less than 100, less than 70. It's becoming more and more aggressive now. We must all strive to improve our good cholesterol, which truly is an uphill task. Trying to increase your good cholesterol, HDL, happens with exercise, the diet, that is fruits and vegetables, flax seeds, fresh these dry fruits, that is almonds and walnuts. So these are certain ways that you would want to increase your good cholesterol and limit your bad cholesterol. But doing a lipid profile, especially if you're in the risk factor profile, really makes the case strong. The guidelines are more and more saying that once we are adults at 25 years of age, it's a good idea to do one lipid profile and then leave it, so that you know where you are in young adulthood about your lipids.
Yeah, interesting. Another question, I think we have time, so we will take up a few more questions. We have a whole host of questions because your talk was very, very interesting and provocative, I am sure. Madhulika Sharma, would you like to ask your question at this point?
Hello, Doctor, I am Rita Malhotra. I have the pacemaker and I'm doing fine at Bangalore. I'm being active. I walk slowly in the morning, but if I miss my 6 o'clock walk, then I don't feel happy. And I want to know, my pacemaker was tested about 15 months back. Do I need to? I am in Bangalore because of COVID.
I remember you very well, ma'am, and I was very happy to see you on the screen and wish you a very happy new year. So it's important once you have a pacemaker, it's important that the pacemaker be interrogated every 6 months. So you must get your pacemaker interrogated. So what we'll do is, outside of this presentation, I'll send you the number of my colleague who's in Bangalore and he'll help you. You must get it checked because it's been quite long.
Okay. Okay, thank you. It's nice to see you. And with your intervention, I'm enjoying the happy. I'm happy and enjoying life.
I'm so glad.
We wish you good health, ma'am, and thank you very much, doctor. Another question from Dr. Meeta Pandit. May I request Dr. Meeta Pandit to ask her question, please?
Hello. Hi. Thank you for this talk. So I wanted to ask, what are the other blood tests which we can do besides the lipid profile that you mentioned to see the risk rate at our age or at any age for that matter? Also, do these blood pressure measuring machines at home, are they reliable? Thank you.
So the blood pressure measuring machines which you use at home have been actually certified by FDA to keep at home and monitor your blood pressure, because it has been noted that if you don't, it's even worse. So they're absolutely fine. They're reliable. You can use them. That's one. Second, as far as blood tests, I'll give you the answer, but it should not be in the order which I'm saying. It should be by the doctor that you go to. But typically what we need is when you want to go to get yourself investigated, it's a good idea you do your hemogram, your lipids, your blood sugar, that is what we call HbA1c, the 3-month profile, a thyroid profile, a kidney function test. So and a vitamin D. Vitamin D has emerged as a new marker, and we have significant data and small data against it, but larger data for it, especially in the COVID times. So I think these are simple blood tests which tell you as to, are you at risk of a metabolic disease or not?
Thank you.
Okay, may I now invite Malini Dheer to ask a question, please, and also simultaneously request Aparna if you'd like to take your screen share off so that we can see everybody else who wants to. Yeah, perfect. Thank you. Thank you, doctor. So Malini, would you want to ask your question? Yeah.
Mugdha, can I request you to ask the question?
Yeah, sure. So Malini's question is, if one has genetic heart arrhythmia, what check does one need over time?
So genetic heart arrhythmia is something that you must essentially go back to your cardiologist. Typically what we do is, the typical tests are two: an echocardiogram. The echocardiogram tells you the functioning of your heart, and we do a Holter. The Holter is a 24-hour ECG recording. Coming back to your ECG, remember, an ECG is just a 12-second tool. That's it. But a Holter tells you for 24 hours how your ECG has been. That's what it is.
So just these two are good enough, and this can be done once a year?
Absolutely. Absolutely.
Great. Thank you so much.
I just thought I'll ask Dr. Aparna one very important question and then come back, because I think we seem to have exhausted the questions of the audience. In case I have missed out, can please raise their hand or just unmute themselves and ask the question. And in the meantime, I'm just going to request doctor, because a lot of us want to know at what stage of our life, without any display of symptoms, just by a simple ECG test, looking at the results of the ECG test, would you suggest somebody to get into a more detailed kind of an examination? So what I'm trying to ask you here is, when the doctor does a ECG test as a routine kind of a thing, maybe say an annual health checkup, now something that will be now accessing the Fortis Escort hospitals, because we seem to have got a huge and good discount, all courtesy you. Maybe an annual health checkup every year will become the order of our, one of the ways of, ensuring.
Yeah.
Huh? Yes. Is there any way common layman people can figure out whether they need to go in for a detailed examination? And if you can elaborate a few cases, because I saw a YouTube video which actually talks of a huge number of cases of how differently. My question, my chance. Elaboration on that.
Yeah, so I'll tell you about, you asked, should we go for any tests? I'll give you a very simple example. If I would take the example of my own self. So I'm 50 years of age. I don't have any cardiac illnesses. I don't have any lifestyle diseases. Would I go for any tests? Well, I am not going to go for any tests, but I am certainly going to make sure that I do my risk factor profile from time to time. If I develop diabetes, or I develop hypertension, or if I'm a smoker, yes, I would like to put all my parents have heart disease. I would like to put myself through a stress test. But typically, if you have asymptomatic, no risk factor profile, you may continue your lifestyle as you are. Having said that, you should understand that 1 out of 3 adults has hypertension, 1 out of 3 adults has diabetes. Okay, so that makes us the penetration of these diseases very large. That means most of us have some lifestyle disease. If you have a lifestyle disease, you should not be caught unawares. It's a good idea to go ahead and do your stress test. As far as the ECG is concerned, all I want to tell you is that we have several tools now. Somebody asked about arrhythmia monitoring. So just to keep it very simple for that individual to take the thing forward, I'd like to share this little thing that you can see on my screen, on my hand. Can you see this? This little tool. How evolved it has become that you can have your ECG done in the comfort of your in your room with this little machine. All you're going to do is hold it in your thumbs. Okay, I'm just holding it in my hand. It's like a visiting card. It will record my ECG and send me the ECG on my phone. So this is where science has come up to. You can keep this little device. You can have your ECG done at any point in time. Send it to your doctor. Trouble your doctor. And, well, talk to your doctor.
Okay, while we were speaking, we have another question, and I think this is a very, very common question, and some stereotypical myth making may be required by doctor. And this is by Girija Rajesh. May I invite her to ask the question?
Hi, thank you for taking my call, and this has been really very informative. Doctor, I wanted to ask you, there's a lot of confusion about eating ghee. Is ghee good for the heart, bad for the heart? That is one question. And second is, what is the resting rate, walking rate, and current rate for somebody who is 50 plus and who's a woman? Those are my two questions.
So first thing is normal heart rate. Normal heart rate should be 60 to 100 times a minute. It can be variable. Those of us who exercise have better resting heart rates. But those who remain excited will have higher heart rates. It has been noted that people with lower heart rates live longer than people with lesser heart rates. So George W. Bush, his resting heart rate used to be about 45. Peter Phelps, that swimmer, his resting heart rate, 38, because they exercise so aggressively. Those who don't exercise will have higher heart rates. So it's an indirect marker that you need to exercise to get your heart rate better. However, it will never be one single number. Well, it will always be juggling between them. That is your first question. Second question, a more difficult one to answer about ghee. So my mother always tells me that it's a good idea to eat ghee. She makes things and she wants me to eat ghee, and there's a constant battle between her and me about ghee. But if I were to put it medically, a life of moderation is a life which sees the end of the tunnel. Always follow a life of moderation. And that's the best way to lead life. There is nothing like do not have this or have just this. Ghee is a milk product. It is certainly of value in your diet because the diet must always contain some amount of saturated, polysaturated, monounsaturated fats. So when you have certain amount of ghee, certain amount of mustard oil, certain amount of olive oil and sunflower oil, you get the right mix. Having said that, a life of moderation, the quantity of the intake of these oils should always be contained. Have them, but have them in moderate quantities. There is nothing good or bad.
Okay.
Okay, thank you very much, Doctor. And we seem to have reached the end of all our questions and queries because of a very, very comprehensive presentation. And then, of course, you've taken out so much of your time to answer all our queries. So thank you very much, Doctor. I think it was a very, very fantastic presentation, quite informative. I think absolutely must for all of us, and especially women, because we are unable to diagnose or feel the symptoms as say our male counterparts would be. So it becomes more important for us, and also because women somehow I think are kind of so busy taking care of everybody that they forget to take care of themselves. So this talk I think will act as a reminder, especially coming early in the new year, that one must at least undergo the routine lifestyle check, the 4 pillars that you have mentioned. And thank you for sorting out and resolving so many of our curiosities and queries. And thank you very much. It was a pleasure getting to know you and to do this interaction with you. And thank you to all our lovely audiences who have asked so many questions and found time to attend this talk today. Good luck and a very, very happy new year. And thank you, Parul, and over to you.
Yes. I think I'm just going to thank Aparna again, Dr. Aparna again. And it's good that so many of us are here. I think the takeaway really is to keep a check on ourselves. I mean, it's a blessing to be having a healthy body, and let's not take it for granted. We keep our exercise, good lifestyle, and a dot of ghee. Definitely, I'm like Mrs. Kumar in this. That a little bit of ghee is kind of very good for the mother. She feels very happy that the children have had it. So do take it, and in moderation. And I think we go from there. That's about it. Take care.
Thank you so much, Parul, for giving me this opportunity to be here.
Pleasure.
And I'm delighted. I can see some of my very close and loved ones here. I can see my parents, Bajorias, Mrs. Jaswal, my sister-in-law, Mr. Anil Rehan, who stood by the whole presentation. So thank you for being here and joining in. I enjoyed it.
Yes.
Bye-bye.
Yes.
Thank you, everyone. And we look forward to your presence.
Thank you so much.